high-risk patients battling COVID-19. Monoclonal antibody treatment. Doctors are using it on patients across the country, but doses are going unused. 2 Works Fuse Brady Halbleib spoke with the patient and joins us in the studio with his message. Brady?
Karen, thanks. Similar to the vaccine, monoclonal antibody treatment uses antibodies to fight the COVID infection and prevent hospitalizations for high-risk patients. Registered nurse Chad Seawright says he wouldn't be here today without that life-saving treatment, and it wasn't until his health took a sharp downward turn after contracting the virus that he finally signed up.
My gut, I was telling me I was going to get worse. I was going to end up in the hospital.
Chad Seawright contracted the virus after working as a nurse at OU Health. With a wife and kids at home, it was important for him to get better and stay out of the hospital.
And so I felt that it was the best option for me to stay out of the hospital.
A colleague at OU Health referring him to the treatment, the FDA authorizing the drug for emergency use back in November. And although it's not fully approved, early studies show it can help prevent the infection from getting worse in high-risk patients.
I honestly believe that it helped me immensely.
So far, Seawright is only among 50 other patients to receive the experimental treatment. OU physician Dr. Rachel Franklin says there are a few reasons why.
First, people are not aware of it, so they don't know that you have to get it early in the course of illness. Well, by the time you're a week to 10 days out, we probably won't be able to get you that infusion.
The next problem isn't its supply, but rather the staff to administer the drug and the space for the patient's infusion.
This infusion takes about an hour to run into your body through an IV, and then you have to be monitored by a registered nurse for another hour.
Patients must also meet a strict criteria to receive the treatment. At OSU Medical Center, you must have a body mass index greater than 35, have a chronic kidney disease, have diabetes, have an immune suppressive disease, are 65 or older, or 55 and older with underlying health issues.
Hopefully prevent them from getting so sick that they're admitted to the intensive care unit and potentially die.
With hospitalization rates at an all-time high, the treatment could help ease the strain.
Helped keep me out of the hospital, it helped me get back to work sooner, and it helped protect my family.
And we're told all the major Tulsa area hospitals are providing the treatment, and because we're still in a state of emergency with the pandemic, the treatment is free. Brady Halbleib, Vera.
Finding out you're COVID positive can be a scary moment, especially if you have underlying health issues. Medical Minute reporter Beth Warden has information on an antibody infusion and a man who says he would have been in the hospital without it.
Yeah, that was the worst headache of my life.
The symptoms of COVID-19 hit Craig Bertrand hard.
Just horrible night sweats, cold and clammy all day, no appetite, and it was hard. Because of the headache, it was hard to even drink water.
Bertrand scheduled an e-care visit with his doctor, and they talked about how COVID could affect his asthma, diabetes, and being overweight. A Bamlanivimab antibody infusion was ordered.
We did a couple questions, checked my heart rate monitor, and then they hooked me right up.
The process was 2 hours, the first hour for the infusion and the rest to monitor his conditions.
After I left the clinic, felt so much better. The headache was gone, everything. I could get out of bed. I've got a 5-year-old, and I was able to play. Just a bad cold is all it felt like. It was nothing like it was.
He thinks of what could have happened without the infusion.
I probably would have been in the hospital at some point.
A Vera family physician, Dr. Chad Turi, says the Bamlanivimab antibody infusion helps a COVID patient fight the virus sooner.
When you get infected with a virus, your body creates antibodies to help fight off the virus. And it takes a while for that process to happen. What we do with monoclonal antibodies is we're providing those antibodies to the patient so they have them to neutralize the virus sooner than what their immune system would be able to do otherwise.
To qualify for an infusion, you need to test positive for COVID, have symptoms, and be 65 or older, or be 55 and older with one or more conditions of high blood pressure, lung disease, compromised immune system, or obesity.
The sooner you have symptoms and you get tested, then the sooner we can get the monoclonal antibody infusion ordered and administered.
Studies have shown the infusion makes a difference.
For about every 10 patients that we give a monoclonal antibody infusion to, we're going to prevent one hospitalization.
Although symptoms of COVID-19 can be treated, the infusion is the only known treatment to help fight the virus.
It would be a no-brainer, and if I would have to do it again, I wouldn't even hesitate. Thank you.
No problem. Have a great day.